A game changer for millions of people who suffer from painful sickle cell disease. Now, the FDA has approved a brand new treatment that has the potential to cure the brutal blood disorder.
Yeah, joining us now to talk about this is Dr. Deena Adimoolam. Welcome back to the show. Thank you for being here today.
Thank you so much for having me.
All right, so first off the bat, for those who are not aware, what exactly is sickle cell?
So sickle cell is a rare genetic condition that affects the blood cells. It causes the blood cells to have this strange sickling shape, which basically leads to decreased blood flow. That decreased blood flow leads to things called vaso-occlusive crisis, which ultimately can lead to excruciating pain. If you ask people who are dealing with sickle cell, they'll say the pain is somewhere close to childbirth or even worse.
Wow.
We have to admit them into the hospital and give them IV pain meds. It's that devastating. If that blood flow continues to get worse, you can have less blood flow and oxygenation to the organs, which can lead to problems with your brain, your kidneys, your lungs, basically all your organ systems. So you can imagine how devastating this can be.
So how does someone know that they have sickle cell, and is it more prevalent in certain demographics of people?
That's a great question. So sickle cell disease is something that we actually pick up on newborn screening tests. So as soon as a baby is born, they're screened for sickle cell disease because we know how significant this disease can impact someone. And so if you're concerned about sickle cell, maybe you have people in your family that have sickle cell trait, you can go and talk to your doctor about doing some blood work and some other testing to help see whether or not you're at risk. Certain communities are at risk as well, African Americans especially. They say 1 in 365 African Americans in the United States have sickle cell disease.
That's really significant.
That's right.
All right, let's talk about this new treatment. It is really the first time in history that this type of therapy has been improved. Why is this a game changer?
Yeah, it's amazing. So this is the first time that the FDA has approved a medication that essentially is editing your genes to treat a disease process. So in this setting, what we're doing is we're taking someone's stem cells, we're giving them this medication, which helps to identify a certain gene sequence. It edits that, and it helps to promote the development of something called fetal hemoglobin. We know that fetal hemoglobin is really great to help prevent vaso-occlusive crises and help improve blood flow. So this is a game changer for people with sickle cell disease.
How different is this from treatments that currently exist, and is it a cure?
So we don't have any treatment that exists like this in the realm of medicine for any other disease processes. So in this situation, most of the treatments that we have for sickle cell is just targeted at decreasing the vaso-occlusive crises. It's not targeted at actually treating the actual sickling effect.
Okay, so what are some of the pros and cons? Are there side effects like with most treatments?
Yeah, so this treatment is pretty extensive. So the first step is that you have to remove one's blood cells, stem cells, and that usually requires a hospitalization to have your stem cells removed after getting really high doses of treatments to increase your white blood cell count, your red blood cell count, and then also to remove those. Once they're removed, they have to be sent to a lab where they're treated with this medication to get the editing technology. Once they're edited, which can take 6 months, the patient then goes to a hospital where they have to take these high doses of chemotherapeutic agents to destroy their own bone marrow. The bone marrow is really important for our blood cell production. So white blood cells, platelets, red blood cells, they all rely on the bone marrow. So if you're destroying that, you can imagine people are at increased risk of infection, they're at increased risk of bleeding, and they require to get red blood cell transfusions. So they have to stay in the hospital essentially until these edited stem cells are available and until their own bone marrow is destroyed. And then they can get the edited bone marrow, and then they again have to wait to make sure that their body doesn't reject it and that they're able to make white blood cells, red blood cells, and platelets so that they can survive.
Sounds intensive.
Yes.
Well, Dr. Deena, thank you for joining us today and telling us about this groundbreaking new treatment.
Thank you so much for having me.
All right, and for more health tips, you can follow Dr. Deena on Instagram. Her information is right there on your screen.